Good morning. I'm Ron Daly. I work with the Kentucky Valley Educational Cooperative, and we are here at the Fire Summit in Pikeville, Kentucky. Fire stands for Forging Innovation in Rural Education, and we want to welcome our guests that are watching this in the state, the Commonwealth of Kentucky, throughout the nation, as well as throughout the world. Because our last event, we had people from 15 different countries, 48 states. I'm very honored to our first interview is with Judge Tim Feely, who is the Deputy Secretary for for Health and Family Services. He keynoted the summit talking about the opioid crisis. So, Judge Feely, I want to thank you so much for being here. And would you tell us what are the challenges with the opioid crisis in the Commonwealth, and what is our state doing about it?
Great. Well, thank you, Ron, for inviting me to be here. Educational summits like this are so important because you get the teachers and students together and work on stuff, and education is close to my heart. But I was asked today specifically to talk about the opioid crisis. It is a crisis. There's no question about it here in Kentucky. We lose approximately 4 Kentuckians a day to overdoses in the opioid crisis, and it's tearing families apart. We have too many children who are being born addicted to drugs, over 1,000 last year. We have too many families being torn apart where about 8,500 children are in the care of the state because their parents, in many cases, had drug problems. So the state is taking it very seriously. Governor Bevin has this as one of his top priorities to deal with the opioid crisis. And at the Cabinet for Health and Family Services, we deal with it both in our behavioral health section and our public health section because it is a public health crisis. So what we're doing statewide is we've got some federal grant money that we're putting into a program that's working on prevention, treatment, and recovery in particular. In prevention area, we're working with the medical community. The medical community is often the start of the opioid addiction. It's not something where someone started, smoking marijuana and went to a higher drug. In many cases, the opioid addiction is somebody who got hooked after getting medical treatment or dental treatment. So we're working with the medical community to make sure that they limit the prescriptions. For example, the legislature passed a bill last time that limited 3-day prescription after a procedure, except in certain cases. That keeps the opioids off of the street and off the market, and also has the doctors making sure that people aren't getting addicted there. So that's one thing we're doing. We have a statewide CASPR program, which is an electronic monitoring system on the prescriptions, that we can tell if somebody's been doctor shopping by going from one doctor to another to try to get the drugs. We can also tell if there are doctors out there who are overprescribing, and we can address those both with the information that we receive from our CASPR system. In the area of recovery, we're working to put in place treatment centers specifically addressing pregnant women with children so that we can get them into treatment as quickly as possible and hopefully save 2 lives instead of just 1. We're also working very closely with the Justice Cabinet in individuals who are being released from prison. Because a lot of times people are in prison because of drug problems or have drug problems when they do other things. They often get a chance to dry out in prison, but we don't want them returning to it, so we're working on programs to prevent prisoners from returning. So those are a couple of the programs, a couple of the many programs we have going on. The other thing we are doing is we're making Narcan available to first responders. Narcan is a drug that is administered to someone who's having an overdose, can immediately end the effects of the overdose, literally bringing people back from the edge of death.
Well, I know in your presentation you mentioned your son works with the fire department in Jefferson County in Louisville, and he'd already saved 2 lives with that drug. We've got about another minute. So, Judge, what if a family member's watching this broadcast? What are the things that they could do if they suspect there's a family member that's got an opioid problem?
The first thing you need to do is safeguard your medicines. Make sure that young children or other people don't have access to your medicines, because sometimes that's how they get involved. That's the first thing to do. Second thing is, if you have an individual that you suspect of a drug treatment program, don't slough it off. You can call your local community mental health center and ask for a referral to a treatment program, and Many are available through the state. Many of them are paid through insurance companies. We're getting more and more paid through Medicaid, and we're not going to turn somebody down. If they have a problem, they get it to the medical, community mental health centers will be the first place to go.
Well, Judge, I want to thank you so much for being here and being our first guest on the program.
I appreciate it, and I appreciate what everybody in Quebec is doing for this area. Thank you.